Okay, folks, we've got a bombshell of an article coming out of ProPublica. UnitedHealth is strategically limiting access to critical treatment for kids with autism. Leaked internal documents show that the insurance giant is culling providers of applied behavior analysis from its network and scrutinizing the medical necessity of therapy. Advocates say the company's strategy may be illegal. Let's dive deep into this thing. Is this article for real? Well, it's clearly a real article, but is it directionally correct? Are the details right? We're going to read it. We're going to figure out, we're going to take notes while we're doing it because we're good readers. There was a time when Sherelle Menard thought her son would never be able to speak. She couldn't soothe Benji when he cried, couldn't read him books that he could follow, couldn't take him out in public. The screaming and screaming and screaming, she said. He would get so frustrated because he couldn't communicate. Okay, so we've got a mom, Sherelle Menard. She clearly wants what's best for her son. Son, Benji, probably also Menard. Benji was 3 years old when he was diagnosed with severe autism and soon after started a specialized therapy to help him develop basic skills. After 2 years in treatment, his murmuring gave way to small words with bubbles among the first. To celebrate, Menard powered up a bubble machine she found at the dollar store. Okay, so really heartwarming story. Starts ABA therapy at 3 years old. After 2 years, speaks. Menard, who's raising Benji alone in South Central Louisiana, began to picture a future for her son that diverged from the stories she'd heard about the same kids with similar diagnoses. Some kids who grew up still unable to manage their frustrations and had to live in a nursing home. Right. So she's really worried about worst case scenarios that her son just won't develop and won't be able to take care of himself. Now she's worried again. The insurer that's been paying for her son's treatment, UnitedHealthcare, has begun to the befuddlement of his clinical team, denying him the hours they say he requires to maintain his progress. Okay, so let's talk about this stuff. What is ABA therapy? ABA therapy it's behavior therapy. When kids get diagnosed, they usually, let me get that in the shot. When kids get diagnosed, they usually get behavior therapy. Often they're prescribed behavior therapy. They get speech therapy, and they get occupational therapy. So each of these works on something a little bit different, but they also have a lot of overlap. So speech is, really about communication, language skills. And then behavior is, it's like really around executive functioning, they'll call it. So this is like taking care of yourself, planning ahead, planning out how to tie your shoes, how to wash your hands. There's some overlap, but these two, they fight about it. And then occupational therapy, this is often around sensory development. Because it's like, if your kid is stuck in fight or flight mode or something like that, you got to desensitize them, or maybe their touch or their smell or something that's really affecting them. So each of these works on something different, but often they work all together for a kid with an autism diagnosis. This article is about applied behavior analysis. This isn't about speech. This isn't about occupational therapy. It's about behavior therapy, also known as ABA. Now, why is ABA really being brought forward and singled out for this specific kid? Benji, who is now 10, requires 33 hours of weekly therapy to progress. So we don't know how much speech therapy or OT he's doing. We know that he's getting 33 hours, and he's been doing this for 7 years now, right? Because he's now 10 years old. That's how old Benji is today. So the insurer, UnitedHealthcare, is saying, we're not going to be covering 33 hours anymore. And this article is really about what they're saying. Why are they saying they're not going to cover it? Actually, it doesn't really address why they're saying it. The author claims to have these secret documents, but when I read the documents, nothing in there seems to be too secret. ProPublica has obtained what is effectively the company's strategic playbook developed by Optum. Optum is another insurer, the division that manages mental health benefits for United. In an internal report, the company acknowledges that the therapy called applied behavior analysis is the evidence-based gold standard treatment for those with medically necessary needs. But the company's costs have climbed as the number of children diagnosed with autism has ballooned. Experts say greater awareness and improved screening have contributed to a 4-fold increase in the past 2 decades. So what they're saying here is way more kids are getting diagnosed with autism, way more autism, and ABA therapy is gold-based. Okay, so gold standard. So why is ABA the gold standard? I mean, you can imagine the kid only has so many hours in the day. So it's like, if they're getting 33 hours of behavior therapy, you can bet they're not getting much speech or OT. The reason why they are the gold standard and insurers will pay for the most number of hours is because they are data-driven, and they've demonstrated through like 30 years of clinical studies that the data that they collect shows what they do works, and when it doesn't work, they will adapt the plan. So if you have a kid that's in ABA therapy, the therapist is constantly collecting data, they're structuring little experiments, creating interventions, and then they're submitting the results of those interventions to the insurer to justify the billing. So you can see maybe where this is going. Optum is pursuing market-specific action plans to limit children's access to the treatment. While acknowledging some areas of very long wait lists, the company said it aims to prevent new providers from joining the network and terminate existing ones, including cost outliers. So what they're saying is our costs have increased so much paying for ABA therapy, presumably because there's way more autism, that we got to manage these expenses, and the way we can manage them is make less ABA therapy available for others. That doesn't sound good. Doesn't sound great at all. Yeah, the company has calculated that in some states, this reduction could impact more than 2/5 of its ABA therapy provider networks, provider groups in network, and up to 19% of its patients. So they're saying that a maximum of 19% of their patients, the clinic that they're going to, that clinic may be out of network. They're saying, we don't want to pay this clinic anymore. So, it's kind of an interesting thing. Like, why do they not want to pay these clinics? And we should save that for later. Why do they not want to pay certain clinics? This is more background info. Optum, whose parent company, UnitedHealth Group, earned $22 billion in net profits last year, is heavily investing in its plan to save millions by limiting access to such care. So they're saying, you guys are rich. Why are you reducing which clinics you're going to pay for? What's up with that? In addition to calling providers from its network, the company is scrutinizing the medical necessity of the therapy for individual patients with rigorous clinical reviews, which can lead to denials of covered treatment. And we think that that's what's happening for Benji, right? Benji is now getting denied. He's been doing this for about 7 years. They've had some success. It's working. And the insurer is saying, hey, no more. We don't want to do this anymore. Mental health and autism experts have expressed outrage. That's what this article is about. It's the outrage because the CEO is killed. They didn't respond to the story. Benji, we said earlier, he's got 33 hours of therapy. And if you reduce those hours by just a few, they've documented the consequences. Toppled furniture, scratched up classroom aids, a kid in unremittent tears, unable to learn. So they're saying if you just cut even a few of his hours, this could be a disaster for this kid. This sounds like a really painful situation, right? For the family. I mean, there's no easy way here, because it seems like it's slow going over there for Benji. This is helping, but it's hard to tell that it's probably helping a lot. And, my intuition, that's probably what's going on here. Your child still has a lot of difficulties with autism-related needs, Optum wrote. Your child still needs help. But it does not appear that your child will improve enough to end ABA. So what they're saying is progress is going so slow for Benji in ABA that it'll never end. And if it never ends, then is this really helping? They didn't say that last part, but I think that's really the question at hand here. So if you recall earlier, the behavior therapist, the ABA clinic, they get the most amount of billable hours because they say that we collect data to show you whether it's working or not. And in this case, they've been submitting data to the insurer. And the data is saying it's helping a little bit, but it's not going to get this kid off of ABA. There is no completion. The response confounded experts who spoke with ProPublica. I'm not sure what's confounding about that. I think that this is a common reason for denial. Who said such an approach misunderstands the long-term nature of his condition. Challenges that often come with autism shouldn't be looked at like an injury that you're going to get better from quickly, and then the treatment can stop. Treatment may still be medically necessary, even if it's for skill maintenance or the prevention of regression. Okay, so what they're saying is, hey, this isn't like a broken leg. You're not just going to fix it, right? This isn't like getting stitches and it heals and it goes away. This is something that's medically necessary forever. The company's denial also appears in contrast with recent professional guidelines for therapy, who are cited as a reference in Optum's own clinical criteria. There is no specific limit on the duration of a course treatment. So they're saying, look, we have documents. Your own documents are saying there is no specific limit. The appropriate duration of treatment, according to those standards and experts interviewed by ProPublica, should be based on the patient's needs as evaluated by the clinicians working directly with the patients. This is a very blunt instrument to chase after excessive costs, said Tim Clement, Vice President of Federal Government Affairs at the nonprofit group Mental Health America. Several advocates told ProPublica the company's strategy is legally questionable. The federal mental health parity law requires insurers to provide the same access to mental health and physical care. As ProPublica recently reported, United has gotten in trouble in the past for targeting therapy coverage in a way that violates the law while denying the allegations. It agreed to a multi-million-dollar settlement. It continues to use arbitrary and one-size-fits-all thresholds to scrutinize its therapy claims. It would raise legal questions if the company restricted ABA more stringently. This is going to require a Medicaid expert, a federal legal expert, to really understand what is the law. Are they following the law? We're not qualified here. It sounds like the company is going to say, our lawyers say, we are in compliance with the law. The authors of the article, or author, who wrote this? Who wrote this? Annie Waldman. Should we look at Annie? All right. She worked for New York Times, worked for somewhere else. So it looks like she writes a lot about mental health. So it sounds like she's taking the view that the company is violating the law. The company is saying, hey, how long do you expect us to pay for this? Now, I think the nuance of the argument here is they're saying it's not working, And that's kind of like the question here. If therapy is sort of working, how long does the insurer need to cover therapy? Second question would be, if therapy is not working, how long does the insurer need to cover therapy? I don't know. Sounds like there's some laws around this, but I think that's the question of essence. Yes, this therapy can be expensive. This guy's an attorney and president of Autism Legal Resources Center. But solving the problem by denying kids access to medically necessary care is a terrible solution. By age 7, Benji had accumulated a few dozen words, and his aggressive, prolonged tantrums had grown less frequent, allowing his mother to take him grocery shopping and to Mass on Sundays. It was time for him to go to school, she thought. She enrolled him in their public school, twice a week special education classroom. Menard urged the district to follow a therapeutic technician to shadow him in school, but it refused. All right, so the district did not give the mom what she wanted. She wanted someone, they're calling him a therapeutic Therapeutic technician. Okay. So what is a therapeutic technician? Probably, like a full-time supervisor, one-on-one care by someone that's trained in autism care. I think that's what we're calling a therapeutic technician. With the diminishment of hours, Benji grew increasingly disruptive. It was a disaster. He snapped a swing in gym class and struggled to sit still. When teachers tried to give him instructions, he hit them. His speech plateaued and eventually regressed. So not only did his development stop, he started moving backwards. This is a really difficult situation. They tell us more about her story, her personal story, and how difficult this was for her. They tell her she had to withdraw from public school. She enrolled him full-time in a home study program run by the therapy group, and it costs $10,000 a year in tuition. She basically spends a huge portion of her paycheck to keep him in this, and that was in addition to the therapy cost, which his insurance still covered. So I think what the author is saying here is that there's a lot of resources being invested in this kid to make sure that he's able to develop as he ages. Benji's clinicians determined he needed direct support for most of the day and told Optum they wanted to scale up his therapy from 24 hours a week to 33. They expected the insurer would approve the request. After all, it was less than what was previously covered and only 9 hours more than what it was currently paying. But Optum denied the increase in the letter, saying your child has been in ABA for 6 years. Okay, I've been saying 7 years, so 6 years. After 6 years, more progress would be expected. We have a photo of the clinician here who was working with him since he was 3. So they're saying, hey, we would have expected way more progress, but your clinician that's trying to bill us for more work, she's saying there's not as much progress as we would expect. This is the clinician. So, the thing that might not be discussed here is there is a company that's making money off of this, right? There is a company that's making money off this. Aspire Behavioral Health. Let's just Google them real quick. Who are these guys? Aspire Behavioral Health. Maybe this is the company. There might be a couple of Aspires. Who sounds about right? Maybe this isn't them. Are there multiple Aspires? Different places? Oh, yeah. Oh, this might be a pretty big company. Okay. They've got lots of different locations. I think that's what's going on here. So this company is making money by billing the insurance company. And the insurance company doesn't want to pay. They're saying, hey, we're done paying. The family, insurance company says, company making money, insurance doesn't want to pay. Family wants more care. Company wants more. What does the company want more? Usually billings, right? Revenue, hours. So there's a little bit of a conflict here, or perhaps you could say a big conflict. The response disturbed Whitney Newton, Benji's behavior analyst and a clinical director at Aspire. It didn't seem rooted in the established medical standards for the treatment. She'd seen firsthand how critical therapy had been to his growth. So she's saying, hey, it is working. We know what he needs. It's in our scope of practice. We're the right people to do it. And it's our right as the provider to determine it. You guys are just being unethical. We're the ones who know how to help this kid. You need to pay us. That's basically what they're saying. And, it's kind of easy to believe that, right? Because, look, this lady's been working with him for 6 years. And on the other side of this is some faceless corporate person who's probably never met the kid. So it's hard to say, okay, well, she doesn't know what's going on, but they do. Here, the center's founder, Jocelyn McCoy, has grown accustomed to battling insurers. Her practice serves about 160 patients between the ages of 2 and 19 across 5 centers. They've got 5 locations. In 2022, Louisiana expanded its Medicaid parameters, allowing parents with higher income to access coverage for children with complex medical needs. What I'm seeing is that children now have this ticket to access the care, but once they try to access it, it's being denied. Nearly 2 years ago, Optum selected her center for a payment integrity audit, demanding to inspect its clinical and billing records. After a team turned over thousands of pages of documentation, Optum conducted a separate in-person quality review. So Optum's saying, hey, what are you guys doing over there? You're charging a lot of money, and we want to make sure that you're charging us for good reasons. Internal company records show Optum is targeting ABA providers for scrutiny based on how much they invoice and how many services they provide. Groups like McCoy's can be flagged for patterns typical in the delivery of ABA therapy, billing on weekends or on holidays, serving multiple family members. Okay, and now here's the secret document. Let's see if we can zoom in here. I don't know how secret this is. These guys are saying, the insurers are saying, hey, we need to make sure we're not getting scammed. And here's how we're going to make sure we're not being scammed. Actionable outlier patterns. Do they have low caregiver training? Are they not teaching the parents what to do? Are they overworking their clinicians? Do you have one clinician working 12-hour days over and over again? Maybe that person's not able to do their job. Do they have multiple family members in here, right? They're saying that's a big indicator of fraud. It's like, wait a minute. You got the brother, the sister, and the cousin in here? Hold on. You're telling us all three of them need all this billable hours? So you could tell there's some real conflict going on here between Optum and this company. Maybe lots of companies. They're saying, hey, this is normal. It's normal to have family members in here. But Optum's saying, yeah, we're gonna audit you. So maybe they cleared them, but Optum has continued to challenge her patients' individual therapy claims. Right? So insurance company challenging company, even after they passed the audit. So they keep saying, you got to prove to us that this is working. At first, okay, so now we're like talking more about the interventions that Benji got. They're saying when the intervention stopped, it got bad. That's what they're saying here. Once they restarted, they got better. They drafted a report. They showed all the charts. They're like, hey, this kid really benefits from this care. They go on to tell us more about the kid's story and what ABA therapy is like. After 10 minutes, a timer beeped. It was time for Benji's reward. Getting to hear a reggaeton hit by Daddy Yankee. It's a big reinforcer here. So they're saying, if he does what he's looking, if he does what he's supposed to, we reinforce that behavior with his favorite song. That's cool. That's common. By common, I mean like, the ABA provider should be finding things that really motivate the kid to do the skill that maybe not so desired, and then hopefully doling out that reward as much as possible. Next month, a state administrative law judge will hear an appeal for the additional hours. If the request is approved, Benji's clinicians will be paid for the 6 months of services they provided without reimbursement. That sucks. This company has been doing the work for free. Company has been doing the work for free. So they're saying, hey, we billed them for these hours. Shit. What? Yeah, they billed them and the insurer hasn't been paying. And the company keeps rendering. So they sent it up to a state administrative law judge. Even if that happens, their battle with the insurer will go back to square one. Each authorization lasts only for 6 months. So they're saying, all right, you're going to pay us for the last 6 months. And then we have to prove to you again that you're going to keep paying us for us. So this is a big fight between, I think that's really like what's not being described here. We're falling into, the author is telling us about Benji's story. I think the real story is the fight between ABA providers and insurers who need to pay them. I think the insurers are getting cold feet. They're saying, hey, we don't know that what you're doing is working, and it's really hard to figure out if it's working. You're telling us it's working, but we have no other way to know if it's working. Like, we'll come check once in a while. You're telling us it's working, but of course you would tell us it's working. You get paid when it's working. And I think the reason, like the unspoken truth here, is the insurance company is saying it's so hard to figure out if this is working that we'd rather just stop offering this and lose these clients. Because what happens is, they're going to say, okay, we don't offer this anymore. We're not going to offer it. So go to Kaiser, go to whoever the other insurer is, Cigna. Maybe they'll cover it for you. You should become one of their clients. And we're talking about a lot of money here. So a kid like Benji is probably worth $50,000 a year of revenue to the ABA clinic. Yeah, so $50,000 a year times 6 years is $300,000. So this is a big financial question. And you can imagine the insurer at the end of the day, like they keep a slice of the money, but they're paying out like 86% of the money. So they could say, all right, we're going to go all in on this ABA therapy, but eventually they're just going to charge their clients more. So this is a battle of saving costs in healthcare. And anybody who pays for healthcare knows this stuff is super expensive. There's an argument made later here that you actually save them money, right? If these kids get interventions they need as children, then there will be tremendous cost savings over the course of their lives. And that makes a lot of sense, right? Because you say, if you can teach them while they're kids, while their brains are still malleable, they're going to be able to take care of themselves. And that's going to save the healthcare system and maybe the government money long term. That makes a lot of sense. Menard worries about what will happen to her son's hard-fought gains if he can't get the level of therapy he needs. And even if the additional 9 hours are approved, she fears with the next authorization, they could fear a more drastic denial. When such denials become common, it disincentivizes clinicians from working with insurance companies. So at the end of the day, they're saying, hey, look, only wealthy families are going to have access to this because the insurance, the providers, the clinics, they're just going to say, hey, we're not going to work with these insurance companies that we have to fight for every 6 months to get approvals for. But even if children like Benji get pushed out of treatment, there's no shortage of children seeking care. McCoy Center currently has a wait list of 260 kids. So they're saying there's just no shortage of services here. This article does a great job detailing the pain of this family, the challenge, the brain damage that these clinicians have had working with these insurance companies. It must be horrible. What the article doesn't do is really talk about the big picture. And it doesn't help us understand, like, when is it correct to pay for therapy? You can imagine, like, not just for autism, but you can imagine, like, if someone's depressed or something like that, but they're not getting better. Should the healthcare system continue to pay for their healthcare? If they're kids, is this education or is this healthcare? This is another big conflict point here, where the insurer may say, look, you're doing good work, but it might not look like medical work to us. This might actually be educational work. So good that this article is covering this. That's my opinion. I think it's smart to get this out in the open and start the debate. I wish that Annie spent a little bit less time talking about one specific family and gave us a little bit more about the big picture. Like, where is this thing going, right? Because, she talks a little bit about the big picture. She's saying there's way more autism, right? So it's like the big picture is, what are we going to do in a world where there's a lot more autism? That's what we should be talking about. All right, well, bravo to Annie, and I hope that this family gets the services they're asking for. I hope that UnitedHealth can find a way to make it work. And maybe the way they make it work is potentially another clinic, right? Because if they're saying, we don't trust this clinic, the family needs to try a different clinic. All right, if you like this video, subscribe, like. If I got it way wrong, if you think I'm way off on all this stuff, tell me why in the comments. Let's hear it. Tell the team. we interact with a lot of families with kids with autism because we make software for kids with autism. So we hear a lot of these stories. They're super painful.